1. What is the best action for the nurse to take before administering a medication through a nasogastric NG tube? Answer. Verify proper placement of the NG tube. Rationale. Verifying NG tube placement, e.g., by checking pH of aspirate or X-ray confirmation, prevents medication administration into the lungs, ensuring patient safety. Misplacement can cause aspiration pneumonia, per Joint Commission standards. 2. What should the nurse do first when a patient reports a new onset of chest pain? Answer. Assess the patient's pain and vital signs. Rationale. Assessment is the first step in the nursing process, prioritizing patient safety. Evaluating chest pain characteristics and vital signs, e.g., heart rate, blood pressure, guides further action, per American Nurses Association, ANA, standards. 3. What is the priority action for a nurse assisting a patient with ambulation after surgery? Answer. Ensure the patient is stable and use a gait belt. Rationale. Patient stability and a gait belt prevent falls, a leading hospital safety risk. Assessing balance and securing the patient promotes safe mobility, per Joint Commission fall prevention guidelines. 4. What should the nurse do when preparing to bathe a patient with a central venous catheter? Answer. Cover the catheter site with a waterproof dressing. Rationale. Protecting the catheter site prevents infection, a serious complication. Waterproof dressings maintain a sterile barrier during bathing, per Centers for Disease Control and Prevention, CDC, infection control guidelines. 5. What is the first action for a nurse when a patient's blood pressure reading is 180/100 mmHg? Answer. Retake the blood pressure to confirm the reading. Rationale. Accurate vital sign measurement is critical. Retaking the blood pressure ensures the reading is not due to equipment error or technique, per ANA standards, before notifying the provider. 6. What should the nurse do to maintain a septic technique during a sterile dressing change? Answer. Use sterile gloves and avoid touching non-sterile surfaces. Rationale. A septic technique prevents wound infection. Sterile gloves and avoiding contamination maintain a sterile field, per CDC infection control guidelines. 7. What is the best action for a nurse when a patient refuses a prescribed medication? Answer. Explore the patient's reasons for refusal and educate about the medication. Rationale. Respecting patient autonomy while addressing concerns promotes informed decision-making. Education may resolve misconceptions, per ANA ethical standards. 8. What should the nurse do to prevent pressure injuries in a bedridden patient? Answer. Reposition the patient every 2 hours and assess skin integrity. Rationale. Repositioning redistributes pressure, preventing tissue damage. Skin assessment identifies early injury signs, per National Pressure Injury Advisory Panel, NPIAP guidelines. 9. What is the priority action for a nurse when a patient's pulse oximetry reading is 88%? Answer. Administer supplemental oxygen and notify the provider. Rationale. A pulse oximetry reading below 90% indicates hypoxemia, requiring immediate oxygen therapy. Notification ensures timely intervention, per American Association of Critical Care Nurses, AACN standards. 10. What should the nurse do when documenting a patient's fall in the medical record? Answer. Record objective details of the incident and the patient's condition. Rationale. Accurate, objective documentation ensures legal and clinical accountability. Details guide care and quality improvement, per Joint Commission documentation standards. 11. What is the best action for a nurse when a patient with dementia becomes agitated? Answer. Use a calm tone and redirect the patient to a familiar activity. Rationale. A calm approach and redirection reduce agitation without escalation. This promotes patient comfort and safety, per Alzheimer's Association care guidelines. 12. What should the nurse do to promote urinary elimination in a postoperative patient? Answer. Encourage fluid intake and assist with timely toileting. Rationale. Adequate hydration and timely toileting prevent urinary retention, a common postoperative complication, per ANA standards for fundamental care. 13. What is the priority action for a nurse when a patient reports severe pain after surgery? Answer. Assess the pain's location, intensity, and characteristics. Rationale: pain assessment guides appropriate intervention and ensures patient comfort. Detailed evaluation informs medication or provider notification per Joint Commission pain management standards. 14. What should the nurse do to ensure safe transfer of a patient from bed to chair? Answer: use a transfer belt and assess the patient's strength and balance. Rationale: a transfer belt and assessment prevent falls during transfers. Ensuring patient stability promotes safety per Joint Commission fall prevention guidelines. 15. What is the best action for a nurse when a patient's foresight shows redness and swelling? Answer: stop the infusion and remove the forecatheter. Rationale: redness and swelling indicate phlebitis or infiltration, requiring immediate cessation to prevent tissue damage or infection per Infusion Nurses Society, INS, standards. 16. What should the nurse do to promote patient dignity during a bed bath? Answer: cover the patient with a blanket and expose only the area being washed. Rationale: maintaining privacy and modesty respects patient dignity, a core nursing principle per ANA Code of Ethics. 17. What is the priority action for a nurse when a patient's temperature is 103 degrees Fahrenheit? Answer: administer prescribed antipyretics and notify the provider. Rationale: a high fever requires prompt intervention to prevent complications like seizures. Notification ensures further evaluation per CDC fever management guidelines. 18. What should the nurse do when preparing a patient for a surgical procedure? Answer: verify the patient's identity and surgical site. Rationale: verifying identity and site prevents wrong site surgery, a critical safety measure per Joint Commission Universal Protocol. 19. What is the best action for a nurse when a patient expresses fear about an upcoming procedure? Answer: listen actively and provide clear, reassuring information. Rationale: therapeutic communication reduces anxiety and builds trust. Clear information empowers the patient per ANA communication standards. 20. What should the nurse do to prevent aspiration in a patient with dysphagia? Answer: position the patient upright and offer small, thickened bites. Rationale: an upright position and modified food consistency reduce aspiration risk per American Speech-Language Hearing Association, ASHA, dysphagia guidelines. 21. What is the priority action for a nurse when a patient's bed alarm sounds? Answer: respond immediately and assess the patient's safety. Rationale: immediate response prevents falls, a priority for patient safety. Assessment identifies risks per Joint Commission fall prevention standards. 22. What should the nurse do when administering oral medications to a patient with difficulty swallowing? Answer: check if medications can be crushed or given in liquid form. Rationale: ensuring safe administration prevents choking or aspiration. Verifying compatibility maintains efficacy per Institute for Safe Medication Practices, ISMP, guidelines. 23. What is the best action for a nurse when a patient's oxygen cannula is dislodged? Answer: reposition the cannula and ensure proper oxygen flow. Rationale: correct placement ensures adequate oxygenation, preventing hypoxemia. Checking flow maintains therapy per AACN oxygenation standards. 24. What should the nurse do to promote bowel elimination in a patient with constipation? Answer: encourage high-fiber foods and increase fluid intake. Rationale: fiber and hydration soften stool and promote peristalsis, preventing complications like impaction per ANA fundamental care standards. 25. What is the priority action for a nurse when a patient reports feeling dizzy while standing? Answer: assist the patient to sit or lie down and assess vital signs. Rationale: preventing falls is critical. Sitting or lying down and assessing for orthostatic hypotension guide care per Joint Commission safety guidelines. 26. What should the nurse do when preparing to insert a urinary catheter? Answer: use sterile technique and verify the catheter size. Rationale: sterile technique prevents urinary tract infections, and correct sizing ensures comfort and function per CDC catheter-associated UTI prevention guidelines. 27. What is the best action for a nurse when a patient's wound dressing is saturated? Answer: Change the dressing using a septic technique. Rationale: a saturated dressing increases infection risk. A septic technique maintains a clean wound environment per CDC wound care guidelines. 28. What should the nurse do to ensure accurate intake and output measurement? Answer: record all fluids consumed and excreted precisely. Rationale: accurate measurement monitors fluid balance, critical for detecting imbalances like dehydration, per ANA documentation standards. 29. What is the priority action for a nurse when a patient with a tracheostomy has difficulty breathing? Answer: suction the tracheostomy and assess airway patency. Rationale: obstruction is a life-threatening emergency. Suctioning clears secretions and assessment ensures airflow, per AACN tracheostomy care standards. 30. What should the nurse do when a patient requests pain medication 30 minutes after the last dose? Answer: assess the pain and review the medication administration record. Rationale: assessment ensures safe dosing, preventing overdose, while addressing pain promptly, per Joint Commission pain management standards. 31. What is the best action for a nurse when a patient's family member asks about the patient's condition? Answer: verify the family member's identity and share information per patient consent. Rationale: protecting patient confidentiality is a legal and ethical duty. Consent ensures privacy, per Health Insurance Portability and Accountability Act, HIPAA regulations. 32. What should the nurse do to prevent deep vein thrombosis in a postoperative patient? Answer: encourage early ambulation and apply compression devices. Rationale: ambulation and compression promote venous return, reducing clot risk, per American College of Surgeons, ACS, DVT prevention guidelines. 33. What is the priority action for a nurse when a patient's pulse is irregular? Answer: assess the pulse for 1 minute and obtain an ECG. Rationale: an irregular pulse may indicate arrhythmia, requiring accurate assessment and ECG confirmation per American Heart Association, AHA, standards. 34. What should the nurse do when preparing a patient for a meal? Answer: position the patient upright and ensure a clean, safe environment. Rationale: an upright position prevents aspiration, and a clean environment promotes comfort, per ANA Fundamental Care Standards. 35. What is the best action for a nurse when a patient with a hearing impairment struggles to communicate? Answer: use written communication or a sign language interpreter if needed. Rationale: effective communication ensures patient understanding and inclusion, per ANA standards for culturally sensitive care. 36. What should the nurse do to maintain a safe environment for a patient with seizure precautions? Answer: pad the bed rails and keep suction equipment nearby. Rationale: padding prevents injury and suction ensures airway safety during a seizure, per Epilepsy Foundation guidelines. 37. What is the priority action for a nurse when a patient's NG tube output is 500 milliliters in 2 hours? Answer: notify the provider and assess for signs of GI bleeding. Rationale: excessive output may indicate bleeding or obstruction. Notification and assessment ensure timely intervention, per ANA clinical standards. 38. What should the nurse do when a patient with diabetes reports shakiness and sweating? Answer: check the patient's blood glucose level and provide a fast-acting carbohydrate. Rationale: symptoms suggest hypoglycemia, requiring immediate glucose testing and treatment to prevent complications, per American Diabetes Association, ADA, guidelines. 39. What is the best action for a nurse when a patient's call light is not functioning? Answer: check on the patient frequently and report the issue for repair. Rationale: frequent checks ensure patient safety and reporting maintains a functional environment, per Joint Commission safety standards. 40. What should the nurse do to promote sleep in a hospitalized patient? Answer: dim the lights and minimize noise in the evening. Rationale: a quiet, dark environment supports the sleep-wake cycle, improving rest and recovery, per ANA Fundamental Care Standards. 41. What is the priority action for a nurse when a patient's urinary catheter output is less than 30 milliliters per hour? Answer: assess for catheter obstruction and notify the provider. Rationale: Oliguria or obstruction requires immediate evaluation to prevent renal injury, per CDC catheter care guidelines. 42. What should the nurse do when a patient with limited mobility needs repositioning? Answer. Use a draw sheet and at least 2 staff members to reposition safely. Rationale. Proper technique and adequate staff prevent injury to the patient and nurse, per Occupational Safety and Health Administration, OSHA, lifting guidelines. 43. What is the best action for a nurse when a patient reports nausea before a meal? Answer. Administer prescribed antiemetics and assess the cause of nausea. Rationale. Antiemetics relieve nausea, and assessment identifies underlying issues, promoting comfort, per ANA clinical standards. 44. What should the nurse do to ensure proper hand hygiene before patient care? Answer. Wash hands with soap and water or use alcohol-based hand rub for at least 20 seconds. Rationale. Hand hygiene is the primary infection prevention measure, reducing pathogen transmission, per CDC hand hygiene guidelines. 45. What is the priority action for a nurse when a patient's oxygen saturation drops to 85%? Answer. Increase oxygen flow and notify the provider immediately. Rationale. Severe hypoxemia requires immediate oxygen adjustment and provider intervention to prevent organ damage, per AACN standards. 46. What should the nurse do when a patient with a language barrier needs discharge instructions? Answer. Use a certified medical interpreter to provide instructions. Rationale. Accurate communication ensures patient understanding and adherence, per Joint Commission standards for culturally competent care. 47. What is the best action for a nurse when a patient's wound shows signs of infection? Answer. Notify the provider and obtain a wound culture. Rationale. Infection requires prompt treatment. Culturing identifies the pathogen, guiding therapy, per CDC wound care guidelines. 48. What should the nurse do to prevent medication errors during administration? Answer. Verify the 5 rights of medication administration. Rationale. Checking patient, drug, dose, route, and time ensures safe administration, per ISMP medication safety guidelines. 49. What is the priority action for a nurse when a patient with a cast reports numbness in the extremity? Answer. Notify the provider and assess neurovascular status. Rationale. Numbness may indicate compartment syndrome, a medical emergency. Assessment and notification ensure timely intervention, per ANA clinical standards. 50. What should the nurse do to promote cultural sensitivity for a patient with specific dietary preferences? Answer. Consult with a dietitian to accommodate the patient's preferences. Rationale. Respecting cultural dietary needs promotes patient satisfaction and adherence, per ANA standards for culturally sensitive care. 51. What is the best action for a nurse when a patient's for infusion is not flowing properly? Answer. Check for kinks, occlusion, or infiltration and adjust as needed. Rationale. Ensuring proper flow prevents complications like infiltration or delayed therapy, per INS infusion standards. 52. What should the nurse do when a patient with a colostomy needs pouch care? Answer. Clean the stoma site and apply a new pouch securely. Rationale. Proper care prevents skin breakdown and ensures appliance function, per Wound, Ostomy, and Continence Nurses Society, WOCN, guidelines. 53. What is the priority action for a nurse when a patient reports shortness of breath? Answer. Assess respiratory status and administer oxygen if needed. Rationale. Shortness of breath indicates potential respiratory distress, requiring immediate assessment and intervention, per AACN standards. 54. What should the nurse do to ensure proper body mechanics when lifting a patient? Answer. Use leg muscles, keep the back straight, and avoid twisting. Rationale. Proper mechanics prevent nurse injury, ensuring safe patient handling, per OSHA ergonomic guidelines. 55. What is the best action for a nurse when a patient's pulse is weak and thready? Answer. Assess for signs of shock and notify the provider. Rationale. A weak, thready pulse may indicate hypovolemia or shock, requiring urgent evaluation, per AHA standards. 56. What should the nurse do when a patient with a new ostomy feels embarrassed? Answer: provide emotional support and educate about ostomy care. Rationale: support and education reduce stigma and promote self-care, per WOCN patient-centered care guidelines. 57. What is the priority action for a nurse when a patient's NG tube is clogged? Answer: attempt to flush the tube with water and notify the provider if unsuccessful. Rationale: clearing the clog restores function, but persistent obstruction requires provider intervention, per ANA clinical standards. 58. What should the nurse do to prevent cross-contamination in a multi-patient room? Answer: use dedicated equipment for each patient and perform hand hygiene between patients. Rationale: dedicated equipment and hand hygiene prevent pathogen spread, per CDC infection control guidelines. 59. What is the best action for a nurse when a patient with COPD reports fatigue during bathing? Answer: allow rest periods and provide assistance as needed. Rationale: rest conserves energy and assistance ensures safety for patients with limited endurance, per COPD Foundation care guidelines. 60. What should the nurse do when a patient's family is interfering with care decisions? Answer: discuss the patient's wishes privately and involve the healthcare team. Rationale: respecting patient autonomy while addressing family dynamics ensures ethical care, per ANA Code of Ethics. 61. What is the priority action for a nurse when a patient's dressing adheres to a wound? Answer: moisten the dressing with sterile saline before removal. Rationale: moistening prevents tissue damage and pain, maintaining wound integrity, per CDC wound care guidelines. 62. What should the nurse do to promote patient safety during a bath? Answer: ensure the floor is dry and use non-slip mats. Rationale: a dry, non-slip surface prevents falls, a key safety measure, per Joint Commission fall prevention standards. 63. What is the best action for a nurse when a patient reports burning during urination? Answer: assess for urinary tract infection and notify the provider. Rationale: burning suggests infection, requiring evaluation and treatment to prevent complications, per CDC UTI guidelines. 64. What should the nurse do when preparing to administer a subcutaneous injection? Answer: pinch the skin and insert the needle at a 45-degree angle. Rationale: proper technique ensures medication delivery into subcutaneous tissue, per ISMP injection safety guidelines. 65. What is the priority action for a nurse when a patient's oxygen mask is causing skin irritation? Answer: apply a protective barrier and adjust the mask fit. Rationale: preventing skin breakdown ensures comfort and compliance with oxygen therapy, per AACN standards. 66. What should the nurse do to support a patient's spiritual needs? Answer: ask about spiritual preferences and arrange for appropriate support. Rationale: addressing spiritual needs promotes holistic care and patient well-being, per ANA Holistic Nursing Standards. 67. What is the best action for a nurse when a patient's wound drainage increases? Answer: assess the wound and notify the provider. Rationale: increased drainage may indicate infection or dehiscence, requiring evaluation, per CDC wound care guidelines. 68. What should the nurse do when a patient with a visual impairment needs assistance with meals? Answer: describe the plate layout using a clock face method. Rationale: the clock face method promotes independence and safety, per ANA standards for sensory-impaired care. 69. What is the priority action for a nurse when a patient's 4 pump alarms for occlusion? Answer: check the tubing for kinks or clots and flush if needed. Rationale: resolving occlusion restores infusion, preventing delays in therapy, per INS infusion standards. 70. What should the nurse do to promote hydration in a patient with nausea? Answer: offer small, frequent sips of clear fluids. Rationale: small sips prevent vomiting and promote hydration, per ANA Fundamental Care Standards. 71. What is the best action for a nurse when a patient reports feeling unsafe in the hospital? Answer: listen to the patient's concerns and address specific safety issues. Rationale: Validating concerns and taking action build trust and ensure a safe environment per Joint Commission patient-centered care standards. 72. What should the nurse do when a patient with a Foley catheter reports discomfort? Answer. Assess the catheter for proper placement and secure it appropriately. Rationale. Misplacement or movement causes discomfort. Proper securing prevents complications per CDC catheter care guidelines. 73. What is the priority action for a nurse when a patient's respiratory rate is 8 breaths per minute? Answer. Assess for opioid overdose and administer naloxone if prescribed. Rationale. Bradypnea may indicate respiratory depression, requiring immediate reversal, per AHA opioid overdose guidelines. 74. What should the nurse do to prevent skin breakdown in a patient with incontinence? Answer. Clean and dry the skin promptly and apply a barrier cream. Rationale. Prompt cleaning and barriers prevent moisture-related damage per NPIAP skin care guidelines. 75. What is the best action for a nurse when a patient with a new tracheostomy is coughing excessively? Answer. Suction the tracheostomy and assess for mucus plugs. Rationale. Excessive coughing may indicate obstruction. Suctioning clears the airway per ACN tracheostomy care standards. 76. What should the nurse do when a patient requests to speak with a supervisor? Answer. Acknowledge the request and notify the charge nurse promptly. Rationale. Prompt escalation respects patient concerns and ensures resolution per Joint Commission patient rights standards. 77. What is the priority action for a nurse when a patient's blood glucose is 50 milligrams per deciliter? Answer. Administer a fast-acting carbohydrate and recheck glucose. Rationale. Hypoglycemia requires immediate treatment to prevent seizures or coma, per ADA hypoglycemia guidelines. 78. What should the nurse do to promote comfort in a patient with a fever? Answer. Apply a cool compress and ensure light bedding. Rationale. Cooling measures and light bedding reduce discomfort without causing shivering, per CDC fever management guidelines. 79. What is the best action for a nurse when a patient's NG tube is not draining? Answer. Reposition the tube and check for kinks or blockages. Rationale. Repositioning or clearing blockages restores drainage, preventing complications, per ANA clinical standards. 80. What should the nurse do when a patient with a mobility aid needs to ambulate? Answer. Ensure the aid is stable and assist the patient as needed. Rationale. A stable aid and assistance prevent falls, promoting safe mobility, per Joint Commission fall prevention guidelines. 81. What is the priority action for a nurse when a patient's incision shows signs of dehiscence? Answer. Notify the provider and cover the wound with sterile saline-soaked gauze. Rationale. Dehiscence requires urgent surgical evaluation. Sterile coverage prevents infection, per CDC wound care guidelines. 82. What should the nurse do to promote oral hygiene in a patient with dentures? Answer. Remove and clean dentures daily and inspect the oral cavity. Rationale. Daily cleaning prevents infection and inspection detects sores, per ANA fundamental care standards. 83. What is the best action for a nurse when a patient reports itching at a wound site? Answer. Assess the wound for infection and apply a prescribed anti-itch cream. Rationale. Itching may indicate healing or infection. Assessment and treatment ensure comfort, per CDC wound care guidelines. 84. What should the nurse do when a patient with a PEG tube needs feeding? Answer. Check tube placement and residual volume before feeding. Rationale. Verifying placement prevents aspiration, and checking residuals ensures tolerance, per Aspen enteral nutrition guidelines. 85. What is the priority action for a nurse when a patient's heart rate is 120 beats per minute? Answer. Assess for causes like pain or dehydration and notify the provider. Rationale. Tachycardia requires evaluation for underlying causes, ensuring timely intervention, per AHA standards. 86. What should the nurse do to support a patient with anxiety during a procedure? Answer. Explain the procedure and use a calm, reassuring tone. Rationale. Clear explanations and therapeutic communication reduce anxiety, per ANA communication standards. 87. What is the best action for a nurse when a patient's oxygen tubing is tangled? Answer: untangle the tubing and ensure adequate length for mobility. Rationale: untangled tubing ensures consistent oxygen delivery and safe movement per AACN oxygenation standards. 88. What should the nurse do when a patient with a new colostomy refuses to look at the stoma? Answer: provide emotional support and gradually introduce stoma care education. Rationale: support addresses emotional barriers and gradual education promotes acceptance per WOCN patient-centered care guidelines. 89. What is the priority action for a nurse when a patient's surgical drain output suddenly stops? Answer: check for blockages and notify the provider. Rationale: sudden cessation may indicate obstruction or complications, requiring evaluation per ACS surgical care guidelines. 90. What should the nurse do to prevent aspiration during oral feeding? Answer: feed the patient slowly and ensure an upright position. Rationale: slow feeding and upright positioning reduce aspiration risk per ASHA dysphagia guidelines. 91. What is the best action for a nurse when a patient's blood pressure cuff is too small? Answer: obtain a correctly sized cuff and retake the measurement. Rationale: an improperly sized cuff gives inaccurate readings, affecting care decisions per ANA vital sign standards. 92. What should the nurse do when a patient with a urinary catheter has cloudy urine? Answer: assess for infection and encourage fluid intake. Rationale: cloudy urine may indicate infection. Assessment and hydration prevent complications per CDC UTI guidelines. 93. What is the priority action for a nurse when a patient's incision is bleeding? Answer: apply pressure to the site and notify the provider. Rationale: pressure controls bleeding and notification ensures further evaluation per ACS hemorrhage control guidelines. 94. What should the nurse do to promote patient autonomy during care? Answer: offer choices within safe parameters and respect preferences. Rationale: supporting autonomy enhances dignity and engagement per ANA Code of Ethics. 95. What is the best action for a nurse when a patient's foresight is cool and pale? Answer: stop the infusion and remove the forecatheter. Rationale: coolness and pallor indicate infiltration, requiring immediate cessation to prevent tissue damage per INS standards. 96. What should the nurse do when a patient with a feeding tube has diarrhea? Answer: assess for tube feeding tolerance and notify the provider. Rationale: diarrhea may indicate intolerance or infection, requiring evaluation per Aspen enteral nutrition guidelines. 97. What is the priority action for a nurse when a patient's oxygen saturation is 90% on room air? Answer: monitor respiratory status and consider supplemental oxygen. Rationale: a borderline saturation requires close monitoring to prevent hypoxemia per AACN oxygenation standards. 98. What should the nurse do to prevent falls in a patient with orthostatic hypotension? Answer: instruct the patient to rise slowly and provide assistance. Rationale: slow position changes and assistance prevent dizziness-related falls per Joint Commission fall prevention guidelines. 99. What is the best action for a nurse when a patient's wound is odorous? Answer: assess for infection and change the dressing with a septic technique. Rationale: odor suggests infection, requiring assessment and sterile dressing to prevent worsening per CDC wound care guidelines. 100. What should the nurse do when a patient expresses hopelessness about recovery? Answer: listen empathetically and refer to mental health support. Rationale: empathetic listening validates feelings and referral addresses emotional needs per ANA holistic care standards. 101. What is the best action for a nurse when a patient with a new ileostomy needs education on pouch care? Answer: demonstrate pouch emptying and changing while explaining each step. Rationale: hands-on demonstration with clear explanations promotes patient independence and confidence in ostomy care per Wound, Ostomy, and Continence Nurses Society, WOCN, guidelines. 102. What should the nurse do when a patient's respiratory rate is 28 breaths per minute? Answer: assess for signs of respiratory distress and notify the provider. Rationale: Tachypnea may indicate hypoxia or pain, requiring immediate assessment and intervention, per American Association of Critical Care Nurses, AACN, standards. 103. What is the priority action for a nurse when a patient's surgical site is red and warm? Answer: notify the provider and document the findings. Rationale: redness and warmth suggest infection, requiring prompt provider evaluation to prevent complications, per Centers for Disease Control and Prevention, CDC, Wound Care Guidelines. 104. What should the nurse do to ensure safe administration of an intramuscular injection? Answer: select the appropriate site and aspirate before injecting. Rationale: correct site selection prevents nerve damage, and aspiration ensures the needle is not in a vessel, per Institute for Safe Medication Practices, ISMP, Injection Guidelines. 105. What is the best action for a nurse when a patient with a hearing aid struggles to hear instructions? Answer: speak clearly at a normal volume and ensure the hearing aid is functioning. Rationale: clear speech and a working hearing aid facilitate communication, promoting patient understanding, per American Nurses Association, ANA, Sensory Impaired Care Standards. 106. What should the nurse do when a patient's oxygen flow meter is set incorrectly? Answer: adjust the flow to the prescribed rate and verify with the order. Rationale: correct oxygen delivery prevents hypoxia or hyperoxia, ensuring safe therapy, per AACN oxygenation standards. 107. What is the priority action for a nurse when a patient's wound vac is not maintaining suction? Answer: check for leaks in the system and notify the provider if unresolved. Rationale: loss of suction impairs wound healing, requiring immediate troubleshooting to restore function, per CDC Wound Care Guidelines. 108. What should the nurse do to promote comfort in a patient with dry skin? Answer: apply an emollient cream and avoid harsh soaps. Rationale: emollients hydrate skin and gentle cleansing prevents irritation, promoting comfort, per National Pressure Injury Advisory Panel and PIAP Skin Care Guidelines. 109. What is the best action for a nurse when a patient with a urinary catheter has no output for 4 hours? Answer: assess for kinks or blockages and irrigate if ordered. Rationale: no output may indicate obstruction, requiring assessment and intervention to prevent renal damage, per CDC Catheter-Associated UTI Guidelines. 110. What should the nurse do when a patient expresses cultural concerns about a treatment plan? Answer: discuss the concerns with the patient and consult the healthcare team. Rationale: addressing cultural concerns respects patient values and promotes adherence, per ANA standards for culturally sensitive care. 111. What is the priority action for a nurse when a patient's pulse oximeter reading is unreliable? Answer: reposition the sensor and assess peripheral perfusion. Rationale: an unreliable reading may result from poor perfusion or improper placement, requiring correction for accurate monitoring, per AACN standards. 112. What should the nurse do to prevent infection during a urinary catheter insertion? Answer: use sterile technique and clean the perineal area thoroughly. Rationale: sterile technique and proper cleaning minimize pathogen introduction, per CDC Catheter-Associated UTI Prevention Guidelines. 113. What is the best action for a nurse when a patient reports pain at an site? Answer: assess the site for infiltration or phlebitis and discontinue if needed. Rationale: pain may indicate complications requiring immediate removal to prevent tissue damage, per Infusion Nurses Society, INS standards. 114. What should the nurse do when a patient with limited English proficiency needs medication education? Answer: use a certified medical interpreter to explain the medication. Rationale: accurate communication ensures patient understanding and safety, per Joint Commission standards for culturally competent care. 115. What is the priority action for a nurse when a patient's blood pressure is 90/60 mmHg? Answer: assess for signs of hypovolemia and notify the provider. Rationale: hypotension may indicate shock or dehydration, requiring immediate evaluation, per American Heart Association, AHA, standards. 116. What should the nurse do to promote safety for a patient with a walker? Answer: Ensure the walker is at the correct height and the patient uses it properly. Rationale: proper fit and technique prevent falls, promoting safe mobility, per Joint Commission Fall Prevention Guidelines. 117. What is the best action for a nurse when a patient's nasogastric tube is leaking? Answer: check the tube for secure connections and reposition if needed. Rationale: secure connections and proper positioning prevent leakage and ensure function, per ANA clinical standards. 118. What should the nurse do when a patient with a pressure injury needs repositioning? Answer: use a low-friction sheet and reposition every 2 hours. Rationale: low-friction sheets reduce shear, and frequent repositioning prevents worsening, per NPIAP pressure injury guidelines. 119. What is the priority action for a nurse when a patient's tracheostomy tube is dislodged? Answer: attempt to reinsert the tube and ensure airway patency. Rationale: dislodgement is a life-threatening emergency requiring immediate airway restoration, per AACN tracheostomy care standards. 120. What should the nurse do to promote nutrition in a patient with poor appetite? Answer: offer small, frequent meals and involve a dietitian. Rationale: small meals are easier to tolerate, and dietitian input ensures nutritional needs are met, per ANA Fundamental Care Standards. 121. What is the best action for a nurse when a patient's incision has a foul odor? Answer: notify the provider and obtain a wound culture. Rationale: a foul odor indicates infection, requiring culture and treatment to prevent sepsis, per CDC wound care guidelines. 122. What should the nurse do when a patient with a PEG tube reports abdominal pain? Answer: stop the feeding and assess for tube displacement or blockage. Rationale: pain may indicate complications, requiring immediate cessation and evaluation, per American Society for Parenteral and Enteral Nutrition, ASPEN, guidelines. 123. What is the priority action for a nurse when a patient's heart rate is 40 beats per minute? Answer: assess for symptoms of bradycardia and prepare for atropine administration. Rationale: severe bradycardia may cause hemodynamic instability, requiring urgent intervention, per AHA standards. 124. What should the nurse do to prevent falls in a patient with impaired vision? Answer: clear the room of obstacles and provide adequate lighting. Rationale: a clear path and lighting reduce fall risk, per Joint Commission Fall Prevention Guidelines. 125. What is the best action for a nurse when a patient's 4 pump alarms for air in the line? Answer: stop the pump and remove air from the tubing. Rationale: air in the line risks embolism, requiring immediate removal to ensure safety, per INS infusion standards. 126. What should the nurse do when a patient with a new colostomy needs dietary advice? Answer: educate about low-residue foods and refer to a dietitian. Rationale: low-residue foods reduce stoma irritation, and dietitian input ensures tailored advice, per WOCN guidelines. 127. What is the priority action for a nurse when a patient's surgical drain is leaking? Answer: secure the drain and notify the provider. Rationale: leakage may indicate dislodgement, requiring immediate correction to prevent complications, per American College of Surgeons, ACS, guidelines. 128. What should the nurse do to promote comfort in a patient with edema? Answer: elevate the affected limb and apply compression as ordered. Rationale: elevation and compression reduce swelling, improving comfort, per ANA Fundamental Care Standards. 129. What is the best action for a nurse when a patient's oxygen saturation is 92% on 2 liters per minute? Answer: monitor closely and assess for respiratory changes. Rationale: a saturation of 92% is borderline, requiring vigilant monitoring for deterioration, per AACN oxygenation standards. 130. What should the nurse do when a patient refuses a bath due to fatigue? Answer: offer a partial bath or postpone until the patient feels rested. Rationale: respecting patient comfort while maintaining hygiene promotes dignity, per ANA Code of Ethics. 131. What is the priority action for a nurse when a patient's blood glucose is 350 milligrams per deciliter? Answer: notify the provider and administer insulin as ordered. Rationale: Hyperglycemia requires prompt treatment to prevent ketoacidosis, per American Diabetes Association, ADA, guidelines. 132. What should the nurse do to prevent infection in a patient with a central line? Answer. Use sterile technique during dressing changes and scrub the hub before access. Rationale. Sterile technique and hub scrubbing prevent bloodstream infections, per CDC Central Line-Associated Bloodstream Infection, CLABSI, guidelines. 133. What is the best action for a nurse when a patient with a cast reports tightness? Answer. Assess neurovascular status and notify the provider. Rationale. Tightness may indicate compartment syndrome, requiring urgent evaluation, per ANA clinical standards. 134. What should the nurse do when a patient with dementia wanders into unsafe areas? Answer. Redirect the patient to a safe area and implement a wander guard system. Rationale. Redirection and monitoring ensure safety without restricting autonomy, per Alzheimer's Association guidelines. 135. What is the priority action for a nurse when a patient's NG tube output is bloody? Answer. Notify the provider and assess for signs of hemorrhage. Rationale. Bloody output suggests gastrointestinal bleeding, requiring immediate evaluation, per ANA clinical standards. 136. What should the nurse do to promote mobility in a patient with arthritis? Answer. Encourage gentle range of motion exercises and provide assistive devices. Rationale. Gentle exercises maintain joint function, and devices support safe mobility, per Arthritis Foundation guidelines. 137. What is the best action for a nurse when a patient's urinary catheter bag is full? Answer. Empty the bag and record the output. Rationale. Emptying prevents backflow and infection, and recording monitors fluid balance, per CDC catheter care guidelines. 138. What should the nurse do when a patient with a terminal illness expresses fear of dying? Answer. Listen empathetically and offer spiritual or palliative care support. Rationale. Empathetic listening and support address emotional needs, per ANA holistic care standards. 139. What is the priority action for a nurse when a patient's incision is gaping? Answer. Notify the provider and apply sterile saline-soaked gauze. Rationale. Gaping suggests dehiscence, requiring urgent surgical evaluation and sterile coverage, per CDC wound care guidelines. 140. What should the nurse do to prevent aspiration in a patient with a tracheostomy during feeding? Answer. Ensure a cuff is inflated and position the patient upright. Rationale. An inflated cuff and upright position prevent food entry into the airway, per AACN tracheostomy care standards. 141. What is the best action for a nurse when a patient's foresight is swollen and painful? Answer. Discontinue the fore and apply a warm compress. Rationale. Swelling and pain indicate infiltration, requiring removal and compress application to reduce swelling, per INS standards. 142. What should the nurse do when a patient with a new ostomy has skin irritation around the stoma? Answer. Clean the area and apply a skin barrier product. Rationale. Cleaning and barriers prevent further irritation and promote healing, per WOCN guidelines. 143. What is the priority action for a nurse when a patient's temperature is 96 degrees Fahrenheit? Answer. Apply warm blankets and assess for hypothermia. Rationale. Hypothermia requires warming to prevent complications like arrhythmia, per AHA standards. 144. What should the nurse do to promote safety during a patient's sponge bath? Answer. Keep the bed at a low height and lock the wheels. Rationale. A low, locked bed prevents falls, ensuring safety, per Joint Commission fall prevention guidelines. 145. What is the best action for a nurse when a patient reports constipation? Answer. Assess bowel history and encourage fiber and fluids. Rationale. Assessment identifies causes and fiber and fluids promote bowel movement, per ANA fundamental care standards. 146. What should the nurse do when a patient with a language barrier needs pain assessment? Answer. Use a pain scale with visual cues and an interpreter. Rationale. Visual scales and interpreters ensure accurate pain assessment, per Joint Commission pain management standards. 147. What is the priority action for a nurse when a patient's pulse is absent during CPR? Answer: continue chest compressions and follow ACLS protocols. Rationale: absent pulse requires ongoing CPR to restore circulation, per AHA Advanced Cardiovascular Life Support, ACLS, guidelines. 148. What should the nurse do to prevent skin tears in an elderly patient? Answer: use gentle handling and apply moisturizer to dry skin. Rationale: gentle care and hydration reduce skin fragility, per NPIAP Skin Care Guidelines. 149. What is the best action for a nurse when a patient's oxygen cannula causes nasal irritation? Answer: apply a water-based lubricant and adjust the cannula fit. Rationale: lubrication and proper fit reduce irritation, ensuring comfort, per AACN oxygenation standards. 150. What should the nurse do when a patient with a feeding tube has residual volume over 250 milliliters? Answer: hold the feeding and notify the provider. Rationale: high residuals indicate intolerance, requiring evaluation to prevent aspiration, per Aspen Enteral Nutrition Guidelines. 151. What is the priority action for a nurse when a patient's blood pressure is 220 over 110 mmHg? Answer: notify the provider immediately and prepare antihypertensive medication. Rationale: severe hypertension risk stroke, requiring urgent treatment, per AHA Hypertension Guidelines. 152. What should the nurse do to promote dignity during a bedpan procedure? Answer: provide privacy and explain the procedure beforehand. Rationale: privacy and explanation respect patient dignity, per ANA Code of Ethics. 153. What is the best action for a nurse when a patient's wound dressing is loose? Answer: replace the dressing using a septic technique. Rationale: a loose dressing risks contamination, requiring sterile replacement, per CDC Wound Care Guidelines. 154. What should the nurse do when a patient with COPD needs assistance with breathing exercises? Answer: teach pursed lip breathing and provide rest periods. Rationale: pursed lip breathing improves oxygenation, and rest prevents fatigue, per COPD Foundation Guidelines. 155. What is the priority action for a nurse when a patient's tracheostomy site is red and swollen? Answer: notify the provider and clean the site with sterile saline. Rationale: redness and swelling suggest infection, requiring immediate evaluation and cleaning, per AACN tracheostomy care standards. 156. What should the nurse do to prevent medication errors during shift change? Answer: perform a double check of medications with the oncoming nurse. Rationale: double checking ensures accuracy, reducing errors, per ISMP Medication Safety Guidelines. 157. What is the best action for a nurse when a patient reports difficulty sleeping? Answer: assess sleep barriers and create a quiet, dark environment. Rationale: identifying barriers and optimizing the environment promote rest, per ANA Fundamental Care Standards. 158. What should the nurse do when a patient with a mobility impairment needs to transfer to a wheelchair? Answer: use a transfer board and assist with proper technique. Rationale: a transfer board and assistance ensure safe, injury-free transfer, per OSHA Lifting Guidelines. 159. What is the priority action for a nurse when a patient's surgical site is oozing serosanguinous fluid? Answer: reinforce the dressing and monitor for increased drainage. Rationale: serosanguinous drainage is normal but requires monitoring to detect excessive bleeding, per ACS Surgical Care Guidelines. 160. What should the nurse do to promote oral health in a patient with dry mouth? Answer: offer frequent sips of water and sugar-free lozenges. Rationale: hydration and lozenges stimulate saliva, preventing oral infections, per ANA Fundamental Care Standards. 161. What is the best action for a nurse when a patient's foretubing is disconnected? Answer: clamp the tubing and reconnect using sterile technique. Rationale: clamping prevents air entry and sterile reconnection prevents infection, per INS Infusion Standards. 162. What should the nurse do when a patient with a new diagnosis feels overwhelmed? Answer: provide simple, clear information and offer emotional support. Rationale: clear information and support reduce anxiety, promoting coping per ANA communication standards. 163. What is the priority action for a nurse when a patient's oxygen saturation drops suddenly to 80%? Answer: administer high-flow oxygen and notify the provider immediately. Rationale: severe hypoxemia requires immediate oxygen escalation and evaluation, per AACN standards. 164. What should the nurse do to prevent pressure injuries in a patient with a cast? Answer: assess skin under the cast edges and pad bony prominences. Rationale: skin assessment and padding prevent pressure damage, per NPIAP guidelines. 165. What is the best action for a nurse when a patient's NG tube is not in place for a scheduled feeding? Answer: verify placement with pH testing or X-ray before feeding. Rationale: confirming placement prevents aspiration, ensuring safety, per ANA clinical standards. 166. What should the nurse do when a patient with a visual impairment needs to navigate the room? Answer: orient the patient to the room layout and keep pathways clear. Rationale: orientation and clear pathways promote safe mobility, per ANA sensory impaired care standards. 167. What is the priority action for a nurse when a patient's incision shows evisceration? Answer: cover the wound with sterile saline-soaked gauze and notify the provider immediately. Rationale: evisceration is a surgical emergency requiring sterile coverage and urgent intervention, per ACS guidelines. 168. What should the nurse do to promote hydration in a patient with dysphagia? Answer: offer thickened liquids and monitor swallowing. Rationale: thickened liquids reduce aspiration risk and monitoring ensures safety, per American Speech-Language Hearing Association, ASHA, guidelines. 169. What is the best action for a nurse when a patient's pulse oximeter is not detecting a signal? Answer: check the sensor placement and clean the site if needed. Rationale: proper placement and a clean site ensure accurate readings, per AACN monitoring standards. 170. What should the nurse do when a patient with a terminal illness requests no visitors? Answer: respect the patient's wishes and communicate the preference to staff. Rationale: respecting autonomy promotes dignity and comfort, per ANA Code of Ethics. 171. What is the priority action for a nurse when a patient's blood glucose is 600 milligrams per deciliter? Answer: notify the provider and prepare for 4 fluids and insulin. Rationale: severe hyperglycemia risks diabetic ketoacidosis, requiring urgent treatment, per ADA guidelines. 172. What should the nurse do to prevent infection during a sterile procedure? Answer: maintain a sterile field and avoid reaching over it. Rationale: a sterile field prevents pathogen introduction, ensuring safety, per CDC infection control guidelines. 173. What is the best action for a nurse when a patient's urinary catheter is leaking? Answer: check for blockages and ensure proper catheter size. Rationale: blockages or improper sizing cause leaks, requiring correction to prevent skin breakdown, per CDC catheter care guidelines. 174. What should the nurse do when a patient with anxiety needs preoperative teaching? Answer: use simple language and allow time for questions. Rationale: simple explanations and interaction reduce anxiety, promoting understanding, per ANA communication standards. 175. What is the priority action for a nurse when a patient's surgical drain is blocked? Answer: notify the provider and attempt to clear the blockage if ordered. Rationale: blockage impairs drainage, risking infection, requiring prompt intervention, per ACS guidelines. 176. What should the nurse do to promote comfort in a patient with a fever? Answer: offer lightweight clothing and maintain a cool room temperature. Rationale: lightweight clothing and a cool environment prevent overheating, per CDC fever management guidelines. 177. What is the best action for a nurse when a patient's foresight is red and warm? Answer: discontinue the fore and notify the provider. Rationale: redness and warmth indicate phlebitis, requiring removal to prevent infection, per INS standards. 178. What should the nurse do when a patient with a colostomy has a high-output stoma? Answer: Monitor fluid and electrolyte balance and consult a dietitian. Rationale: high output risks dehydration, requiring monitoring and dietary adjustments, per WOCN guidelines. 179. What is the priority action for a nurse when a patient's respiratory rate is 40 breaths per minute? Answer: administer oxygen and assess for underlying causes. Rationale: severe tachypnea indicates respiratory distress, requiring oxygen and evaluation, per AACN standards. 180. What should the nurse do to prevent falls in a patient with a history of seizures? Answer: keep the bed in the lowest position and use padded side rails. Rationale: a low bed and padding reduce injury risk during seizures, per Epilepsy Foundation guidelines. 181. What is the best action for a nurse when a patient's wound is not healing? Answer: assess for infection and consult a wound care specialist. Rationale: non-healing wounds may indicate infection or poor perfusion, requiring expert evaluation, per CDC wound care guidelines. 182. What should the nurse do when a patient with a PEG tube needs medication administration? Answer: crush medications if allowed and flush the tube before and after. Rationale: crushing and flushing ensure delivery and prevent clogging, per Aspen enteral nutrition guidelines. 183. What is the priority action for a nurse when a patient's heart rate is 180 beats per minute? Answer: notify the provider and prepare for cardiac monitoring. Rationale: severe tachycardia risks arrhythmia, requiring immediate evaluation, per AHA standards. 184. What should the nurse do to promote bowel regularity in a patient on opioids? Answer: administer prescribed laxatives and encourage fluids. Rationale: opioids cause constipation, requiring laxatives and hydration to prevent impaction, per ANA Fundamental Care Standards. 185. What is the best action for a nurse when a patient's oxygen mask is slipping off? Answer: adjust the straps and ensure a snug fit. Rationale: a secure mask ensures consistent oxygen delivery, per AACN oxygenation standards. 186. What should the nurse do when a patient with a new diagnosis requests more information? Answer: provide written materials and explain in simple terms. Rationale: written and simple explanations enhance understanding, per ANA Patient Education Standards. 187. What is the priority action for a nurse when a patient's incision is swollen and hot? Answer: notify the provider and apply a sterile dressing. Rationale: swelling and heat suggest infection, requiring urgent evaluation and sterile coverage, per CDC wound care guidelines. 188. What should the nurse do to promote safety in a patient with a cane? Answer: ensure the cane has a rubber tip and teach proper use. Rationale: a rubber tip prevents slipping and proper use ensures stability, per Joint Commission Fall Prevention Guidelines. 189. What is the best action for a nurse when a patient's NG tube is displaced? Answer: stop any feedings and notify the provider. Rationale: displacement risks aspiration, requiring immediate cessation and evaluation, per ANA clinical standards. 190. What should the nurse do when a patient with a tracheostomy needs oral care? Answer: use a soft toothbrush and avoid aspiration risks. Rationale: gentle brushing prevents infection, and aspiration precautions ensure safety, per AACN tracheostomy care standards. 191. What is the priority action for a nurse when a patient's blood pressure is 80/50 mmHg? Answer: place the patient flat and notify the provider. Rationale: severe hypotension risk shock, requiring positioning to improve perfusion and urgent intervention, per AHA standards. 192. What should the nurse do to promote comfort in a patient with joint pain? Answer: apply a warm compress and position for comfort. Rationale: warmth and proper positioning reduce pain and stiffness, per ANA Fundamental Care Standards. 193. What is the best action for a nurse when a patient's fore-pump is beeping continuously? Answer: check for occlusion or air and troubleshoot the issue. Rationale: troubleshooting restores infusion, preventing delays, per INS infusion standards. 194. What should the nurse do when a patient with a cultural dietary restriction needs a meal plan? Answer: collaborate with the dietitian to meet cultural needs. Rationale: cultural respect enhances adherence and satisfaction, per ANA Culturally Sensitive Care Standards. 195. What is the priority action for a nurse when a patient's tracheostomy is blocked? Answer: suction the tracheostomy and attempt to clear the obstruction. Rationale: blockage is a life-threatening emergency requiring immediate suctioning, per AACN Tracheostomy Care Standards. 196. What should the nurse do to prevent dehydration in a patient with vomiting? Answer: offer small sips of oral rehydration solution and monitor electrolytes. Rationale: small sips and electrolyte monitoring prevent dehydration, per ANA Fundamental Care Standards. 197. What is the best action for a nurse when a patient's wound dressing is wet? Answer: change the dressing using a septic technique. Rationale: a wet dressing increases infection risk, requiring sterile replacement, per CDC Wound Care Guidelines. 198. What should the nurse do when a patient with a mobility aid reports arm pain? Answer: assess for overuse injury and adjust the aid's fit. Rationale: proper fit reduces strain, and assessment identifies issues, per OSHA Ergonomic Guidelines. 199. What is the priority action for a nurse when a patient's oxygen saturation is 87% on 4 liters per minute? Answer: increase oxygen flow and notify the provider. Rationale: severe hypoxemia requires immediate oxygen escalation and evaluation, per AACN standards. 200. What should the nurse do when a patient expresses guilt about their condition? Answer: listen actively and refer to counseling services if needed. Rationale: empathetic listening and referral support emotional well-being, per ANA Holistic Care Standards.